there are a couple of interesting examples I have that, so when I finished my master's, I finished my exam. I have a patient that I've been working with for a long time. She's in her 60s, highly anxious. We've been doing some wonderful work together. And she came in to see me one day, and it was off the cuff. I mean, she wasn't talking to me about this necessarily. She was just telling me what she had done with her primary care doc. And said, gee, you know, I've got terribly high blood pressure. Can you believe I've got to start a blood pressure medication? And I said, tell me again, what psychiatric medications are you taking again? She said, I'm on venlafaxine. I said, you know, venlafaxine can cause high blood pressure, oddly enough. It's an SNRI, and sometimes it does, sometimes it doesn't. But I would go back and talk to your primary care doc and just suggest it. You can tell her that we talked. She did, and her primary care doc said, oh, gee, I've put people on that before. It's never happened. That's interesting. Let me look it up. Oh, yes, indeed, it can cause high blood pressure. Let's see if it's dose related. They lowered the dose. Still high blood pressure. In the meantime, she had some cardiac issues, and she was seeing her cardiologist and mentioned it again to the cardiologist. The cardiologist had never heard of such a thing, that this medication could cause high blood pressure. Looked it up, sure enough, it does. Took her off the medication. Within a week, her blood pressure was normal. So I thought, wow, you know, this wasn't something I prescribed, but it was knowledge that I had that I could help the patients with. So I felt phenomenal, and I think she did too.
Yes.
Wouldn't that be interesting if psychologists could end up doing ECT as well? And one of the patients, I remember before she went under, she was talking about some numbness in her thumb. And so the psychiatrist and anesthesiologist and I were kind of talking to her and trying to figure out where it came from and, you know, what nerve. And finally, you know, I'm thinking through my own training, I'm thinking, what is it? C. Anyway, the anesthesiologist said it's C6. I'm pretty sure it's C6. And the psychiatrist said, well, let's look that up real quick. Yeah, we all kind of did this together as a team.
Yes.
And indeed, we figured it was probably C6. Otherwise, if I hadn't gone through the training, I wouldn't have even thought about it. There were medical students coming in to watch and observe the ECT as well. And so we would all, you know, be questioned as if we were all medical students, which can be kind of daunting. Little anxiety provoking, but you know, it gets the wheels turning. And so the psychiatrist was throwing out questions about axon potentials and, you know, drawing a picture and wanting to know, does anyone know what the resting potential is? And they were kind of scratching their heads. And I was like, -70. I knew that off the top of my head. So I think he said, well, wait a minute, let them answer the question. And I thought, wow, here I am a prescribed, and I had it first.
Yes.
So.
Yes.
And, you know, thinking about the future and what it will look like, I see social workers, LCPCs, psychologists will be referring to us,
Yes,
who you know, who aren't going through this program, primary care docs, other specialties. You can't get in to see a psychiatrist. You really can't. There are many good ones, but there are very few. In the United States right now, most psychiatrists are over the age of 50. And programs are closing and people aren't going into the field. The psychiatric rotation I did, I was training with APNs and PAs, and the psychiatrist that was training us, and he still is, we have lectures, and he said the thing you are bringing to the party that they cannot bring, again, is you understand the underpinnings of a human being. What are their psychodynamics? What is going on that leads to the correct diagnosis that then drives what kind of medication you're going to give them. But it's all about the diagnosis. And I think if you don't have that psychodynamic training, how could you really, really have a clear understanding of the human being? Yeah. Right? And when you really think about it, it's inclusive. I mean, mental illness or just mental health issues are everywhere. So, I mean, we're creating an environment where everybody can access, you know, help for mental health issues. So we're not taking away from anybody. We're just adding. And that's the power of what we're doing. I feel like it's opened so many doors just in my own mind for I think, I wouldn't say I was in a rut, but I think I was seeking something else. I was ready to just take it to the next level. And so after I spoke to Dr. Ram Reiner, she just energized me, and I thought, I'm going for this. It was the best thing I'd ever done. I'm thrilled. It's changed my life in every way.